So today was the day that I was going to get my teeth finalized and the holes filled. And they put back in set one. So this is set one. You can see here, a little different. Not much different, just a little bit different. So with these, I lose a bit of the lip fullness that I have mentioned in the past, but I think I like the way these look more, but you know, it's really hard. Like I told him today, I have two perfect sets to choose from, and it's almost impossible. They're very much the same. They're enough different to make them different. And I'm just torn still. So the final will be in 2 weeks. So I'm going to go back in 2 weeks and hopefully have made a decision. If I can, I prefer these, but if do I want to lose the volume in my mouth? It looks so puckered, but I think it would do that with the other ones too. Okay, so I have a few lessons that I've been writing down. I thought, well, I'll document these. I've probably said most of them throughout my other videos, but I thought that I would go ahead and just kind of recap and clarify. So I was looking at a couple of the beginning videos, and I realized that I had said that there was no pain, which contradicted the statement that there was a lot of pain from after I had the surgery. So to clear that up, the deal is when when you have the surgery, you're obviously uncomfortable, right? But the pain was primarily during the surgery, the pain that I was talking about, I was just kind of done and I wanted to finish, I wanted to go home. That pain was because when he was putting on the temps, it was pushing on the tori, which is kind of like bone growth, and it was hurting. So I was just like agitated because of the, I think because of the sedation. I became agitated, and eventually I was just like, just stop, because I just put it on and don't worry about it, and I'll worry about it later, because I wanted it to stop. And it's funny because when I got home, that particular pain didn't hurt anymore. It was just, I think, a combination of just being done with the whole day. I was just ready to go and put it off. So all of that was good. There was pain, but it was very low level pain, and a lot of it was related to just swelling and bruising and you know, that kind of stuff. There was no, like, I've had dental pain my whole life, and there was nothing like dental pain. There was none of that electric shock kind of pain that you get with dental problems. There was no earache if you've had, you know, abscess teeth like I have. I've had abscesses I had an abscess tooth over here, or maybe it was over here, and the swelling went all the way around. So they had to put a drainage tube in there and drain it from here all the way around to here. It was really a dangerous abscess, but anyway, I've had tooth pain, and this pain wasn't bad. I didn't take any of the painkillers until really most of the pain had gone. So I took it just kind of for fun, but I didn't really need them. It was the discomfort I was having was really, like I said, it was just one of the problems that I had was that my face had gotten so chapped, and that was super painful. The chappedness, I don't know what causes that, but I get it anytime I have anything done. And my lips, my lips were peeling really bad too. So those were, I mean, but on a scale of 1 to 10, we're talking very nominal, but when you're bitching about pain, that's just kind of, you know, it's just pain. Pain is pain. So, okay. So number one is try not to use too much mouthwash, and don't keep it in your mouth too long. I've figured out how to use mouthwash without it hitting my tongue, because my tongue is extra sensitive. I really wasn't much of a mouthwash user, and my tongue it seems to be very sensitive to mouthwash. So I've figured out a way to do it, to use mouthwash without it hitting my tongue and staying on my tongue. What I was doing was I was putting mouthwash in my mouth and holding it for much longer than I should have, and my tongue was getting extremely irritated. It felt like it was scorched, so that's a good lesson to know. If you have a tooth, when they screw them in and it feels kind of wonky, and the dentist checks the seating on the tooth and says it's fine, give it a couple of weeks, because I had that one side that was kind of pinching when he put that other set on, and I was adamant that it was hurting and it wasn't gonna work. But we decided to go ahead and see if it'll I don't know, settle down or something. I don't really know, adjust maybe is the right word. And sure enough, over a couple of weeks, it adjusted and just became my teeth. I mean, it wasn't anything that that felt weird after a couple of weeks. So if it feels wrong, if you can, give it a couple of weeks to settle in and see if it still hurts before you wig on your doctor. If, again, they took my teeth off, and my teeth that I have been wearing for a month or whatever, however long I've had those in this time, they look perfectly clean, and my advice with that is water pick and water pick and water pick. Just water pick all the dang time. I water pick all the time. And I'm used to it, and it doesn't take that long, and it feels better. The next thing is to get a super fine toothbrush. They make super fine ones. I can't remember. They sell them at Walmart, but they're kind of an ombre color. Like they go they're kind of ombre, if you know what that color means. Google it if you don't. But they're real thin, and they have long, whisper thin bristles, and they can get behind this. I can't floss. There's no way for me to floss under these, so I have to rely on a water pick and a toothbrush, and I get my teeth clean without dental floss. So, but that brush is able to get down behind here. I can stick it behind. Acrylic smells. If you can do anything talk to your doctor. If you're scheduled to get acrylic for your All-on-4, I personally, and I don't know anything about anything, but I personally feel like acrylic is not suitable for this purpose, because you need to be able to clean acrylic, like deep clean it every day, because it's porous and it absorbs odors and stuff. So if you have a dentist that's going to be using acrylic, question them. If they want to do a zirconia upper and an acrylic lower, tell them that you would prefer to have a zircon set. Not a zirconia, but a zircon set, the nano porcelain set, because they're light, they don't clack. They feel like regular teeth, they don't clack. If you get two zirconia, it's amazing how heavy those teeth are, and they clank like two glasses toasting. So and this is just my opinion. If you have zirconia on top and bottom, that's great if you're used to that. But I was worried about the stress on my bone, having two upper and lower with the zirconia, because it was, they're hard, they're real rigid. The nano porcelain, the nano teeth these are called zircon teeth. they are flexible. So you don't have the stress on your bone that you would with zirconia. This is a better material than zirconia. But if you want zirconia, that's great. Just get the upper and then get these for the lower. But I think I would worry if a doctor was recommending acrylic for this procedure at all, because, man, I tell you, it stinks. You can eat anything. These teeth are better than teeth. I haven't had teeth this good in 40 years, and it's crazy to be able to eat anything I want. With crowns, they might look good at the beginning, but when you start chewing, you could pull them off. These, I mean, there's nothing. They feel like normal teeth, and let me step back. They don't feel like normal teeth. You can't feel them. So it's not quite the same as normal teeth, but they function just like normal teeth. They look like normal teeth, and they chew like normal teeth, and you can eat anything. It doesn't mean you should eat anything, because I've been really careful with my teeth for years because they would break. So I'm going to continue being really careful with these teeth, because if it can break a tooth, it can break these teeth. So why be reckless just because I have all these teeth now? Let's see, last but not least. In my previous videos, I would say that these perms, the temps I could wear as perms, I could. But I am not kidding you when I say that the permanents are totally different. It is a whole different ball game when you get these permanents in. They're nothing like the temporaries. And they fit better, they feel better, they function better, they look better. Everything about your permanents will be better than those temps. And the temps are great for what they're for. And I'm going to have him give me my temps so I can carry them when I travel, which sounds crazy, but when you travel, if I go say I'm going to the UK this spring for work, if something happens and I bust this, God, I hope I don't. But if I fall or whatever, if I'm in an accident and I break it, then I'll at least have the temps to get me through till I get home. I don't want somebody overseas repairing anything. So I'm going to carry it every time I travel in a little case. And so the temps are great for that. They're great. They can serve as an emergency set. I can clean them really, really good and put them in a case and carry them with me. So, but there's no doubt that the perms are completely separate. And I just had no idea when I was making the other videos. I just had no idea how different that they are. It's amazing, really. It's pretty crazy. So that's it. That's all I have written down today. So just a good look at these teeth. Again, these are flatter, a little flatter, a little further back. You don't see the bottom as prominently as the other set. The other set, you could see the bottoms pretty prominently. Sorry, good grief, I don't know why I'm yawning. So I'll give you a look here. I go all the way back. All the way back. Some people say their dentist cut some off, like here. But mine go all the way back. I don't have any TMJ at all. No headaches. I occasionally get a little throbbing still because I think I over water pick sometimes. But I don't have any pain associated with these at all. And they're not a hassle. I have a little air still coming through because I went from one set to the other, and it takes like a day for your gum to readjust. So if you do like I'm doing, and I have 2 different sets I've been alternating between, my gums get shaped like the other set, and when they take those off and put these in, my gums have to like plump back up to fill up the gaps, and they will. They will. I've experienced the phenomenon before, and I guess that's it. I'm super happy, right? It's so nice to have pretty teeth, and it's so nice to be able to smile confidently and not have anybody looking at me because my teeth are bad, like I don't care about myself. And just if you're going through the process, just be sure to take really good care of them. And you'll hear people say on the internet, well, you got this bad for a reason. And I disagree. I think some people have bad oral hygiene, but I didn't have bad oral hygiene. I had bad teeth, and I didn't have any damn money. And when you combine bad teeth with bad money, no money, that's a combination for disaster. And that's exactly what happened to me. I didn't have money for from 15 years old to 32 years old. And during that period of time, I was having a lot of dental issues, and I couldn't afford to do the right thing, so I had to do the cheapest way. And the cheapest way was pulling them for a lot of them. And then I started, anyway, I've already told the story, but I can't stress how important it is to keep these really, really clean. That way, they'll last you for years and years, So your goal should be, when you go to the dentist, when you have these teeth, for them to be amazed at how clean they are. That's the goal. So anyway, until 2 weeks from now, I'll post my final. And then the next time you'll hear from me is when I get them cleaned. But I think in 2 weeks, I'll hopefully pick which pair I want. But these are still my favorite. They're just, my lips are just a little small. Damn it. Okay. All right. Well, y'all have a great January, and I'll talk to you in February. Bye.